Hello, I am Daniel Golshani. In this video, I would like to explain to you why I believe an abdominoplasty is an empowering procedure which is life-changing and can significantly improve the lifestyle of the patients who are candidates for this procedure. Abdominoplasty or a tummy tuck is one of the most powerfully life-changing procedures performed by plastic surgeons. It empowers the patients by improving self-image and allowing the patient to move forward with their life challenges. And this is something that I have seen in multiple cases over the many years, how a simple procedure such as a tummy tuck can help many patients move forward, empower them in the stages of their lives if they are candidates for a tummy tuck. It enables thousands of women and men every year to undergo a personal transformation, and I hope to be able to describe and exemplify that in this video for you. More than 100,000 people undergo a tummy tuck in the United States every year. It's one of the most commonly performed procedures, and it's a very safe operation which can be performed without difficulty and with an excellent outcome for the patient. Who is a candidate for a tummy tuck? Let's look at the significant stories which could lead to you being a candidate for a tummy tuck. The simple description is a patient who has loose skin, loose muscle, and excess fat in the abdomen. But these are usually situations where dieting or exercise or lifestyle change hasn't really been able to achieve what the patient wanted, and they have reached a place where they find that they need help. And that's where the plastic surgeon comes in. We don't usually recommend everybody who's overweight or everybody who has loose skin to undergo a tummy tuck. And if the patient presents with all of these symptoms, but at the same time feels that they're not able to get the result that they want with lifestyle change or dieting, that's when they could potentially be a candidate for a tummy tuck. So, as I said again, presence of loose skin, excess fat, and abdominal muscle laxity. In the next slide, when exercise and weight loss is just not enough. So I included the next slide in there. A patient who is physically very active, but she still comes in to see me because she feels that she can't get rid of that loose skin in her lower abdomen, and she needs help. And that is the most common presentation for somebody who qualifies and is a candidate for a tummy tuck. After having babies, the number one reason for tummy tuck oftentimes has to do with having been pregnant before. During pregnancy, the abdominal muscles stretch, they separate from each other, and it's almost impossible for many patients to regain that youthful, tight abdominal look because the muscles are just impossible to get back to their original position, and the loose skin is impossible to shrink down with just normal physical activity or exercise or weight loss. After weight loss from dieting and exercise or weight loss surgery, this is also another common scenario where patients have lost lots of weight, whether they had bariatric surgery or whether they just changed their dietary habits and started exercising. And they present to my office with significant skin laxity, and that's when a tummy tuck becomes an amazing way for them to proceed forward and make the changes that they originally were looking for. So what is a tummy tuck or abdominoplasty? It's a procedure that allows us to remove the excess fat, loose skin from the abdomen, and also tighten the abdominal muscles. And in another video, I will be describing all of these separately, so we won't really get into detail with that during this video. In the next slide, we will be pointing at what are the goals that we have. And in this diagram, you can see we want to achieve a flat abdominal contour. We want to show the normal muscle tone that is present and abdominal curvature. And we want the results to look natural. We don't want the patient to look like they've had surgery. And that is the ultimate goal of a perfect abdominoplasty, is to make sure that we have a natural result with a hidden surgery. It should be invisible, the fact that you've had a tummy tuck. Here's an example of a patient who had 3 children, and she presented to my office. She just didn't know what to do. She tried weight loss, it didn't work. That loose skin in front of her tummy would not go away no matter what she did. We did a full tummy tuck for her, as you can see in the next slide, and this is her several months after her tummy tuck. We also did some fat grafting, liposuction in the lower flanks, and fat grafting to her buttock. And just within several months, she completely transformed. She actually went on to lose another 20 pounds after her surgery. She was very happy with her results, felt that she got exactly what she wanted from a procedure which enabled her, whereas before for several years, she just couldn't get to that point where she was happy. In the next slide, we can see, again from an oblique view, this is that same patient before tummy tuck, lots of stretch marks below her belly button, and the loose skin and the loose muscle. And afterwards, in the oblique view, this is the same patient, but she's lost several pounds a few months after her surgery. You can see that beautiful muscle contour in the midline of her tummy, and the umbilical scar is almost invisible at this point. The stretch marks are mostly invisible or gone, removed from the previous location because of the abdominoplasty. And as a whole, she has an aesthetic look which allows her to move forward, be active, and proceed with her goals and aspirations. So one question that we ask is, are there different kinds of abdominoplasty? And the answer to that is yes. There are many different kinds of abdominoplasty, and every patient may require one or another modification to a tummy tuck. So where one patient may have required a full tummy tuck like the previous patient I showed, some patients may require a mini tummy tuck or a combination of a tummy tuck with a liposuction. In the next slide, we can see the list of all the different tummy tuck procedures that exist. For example, you can have just a mini tummy tuck if you're a candidate for that, or you can have a full tummy tuck or an extended abdominoplasty, which is for the patients who have lost significant weight loss and have lots of loose skin that goes all the way around their waist. A panniculectomy is an abdominoplasty which is limited to the lower abdomen. A belt lipectomy is removal of the excess fat from around the waist in patients who've had significant weight loss. Marriage abdominoplasty is a combination of a mini tummy tuck and liposuction, where we can really put together multiple modalities to get a beautiful result for the patient. And it comes in lateral tension abdominoplasty is a modification of an abdominoplasty which allows us to really improve the waistline and the curves in the waist. And another procedure is endoscopic abdominoplasty. Sometimes we don't have the luxury of releasing the umbilicus, and we have to endoscopically free the skin and tighten the muscles above the umbilicus without releasing the belly button. And this might be necessary in some patients, and I have successfully performed it in patients with excellent results. So here's a patient who came all the way from Europe. She is a marathon runner, and she wasn't happy with that skin hanging over her belly button and some of the loose skin below her belly button, but otherwise she was fine. And in her case, we had to perform a mini tummy tuck and an umbilicoplasty, which is basically removing the extra loose skin from above her belly button and performing a tummy tuck inside her belly button. So you can see in the next slide, that loose skin above her belly button is gone, the skin below her belly button is tight, and she was very happy and achieved what she wanted and could very quickly go back to her lifestyle. The next patient is a young lady who had 2 children, and she suffered from significant muscle looseness, laxity of her abdominal muscles. She just could not get back to her previous body tone and shape. She had loose skin below her belly button, but also had this protuberance of abdomen, which required a lot of muscle tightening on my behalf and a lot of exercise on her behalf afterwards. But the ultimate outcome was amazing and really life-changing for her. In the next slide, we can see her from the side view. We can see there's an umbilical hernia. There's a little hernia in the belly button area. She has significant stretch marks. Her muscles are really loose, and she has the loose skin down here, which needs to be addressed as well. So let's go to the slide where we can see her afterwards. This is her several weeks later. We did a multi-directional muscle tightening of her abdominal wall. We removed all the loose skin and placed her incisions in a hidden location and tightened up her muscles and got her to this point where she was ecstatic and happy and felt that she could be herself again, and it brought tears to her eyes at this point. And it's because she felt empowered as she could move forward with what she wanted to do next, go to the gym, take care of herself. Here she is in the side view. It's a pretty early on photograph, so we can still see that the umbilical scar is a little red, but the stretch marks are less visible. Even most of them have been removed, but the ones that are there are less visible because of the tightening as well. And in the next slide, we can see her from the front view before surgery with that protuberance, and then here she is afterwards with a flat abdomen. This is another example of a empowered patient. Here is a patient who had a bariatric procedure. She had a laparoscopic gastric bypass, lost 100 pounds, came to see me because she wasn't happy. She felt like she needed a tummy tuck to remove the loose skin and tighten up her muscles, and that's exactly what she got. We did a tummy tuck for her, and subsequently she felt so good that she lost another 30 to 40 pounds. Here in the next slide, we can see her. This is her several months later, about a year later. You can see where her laparoscopy incisions were before. They were way up, and now they've moved to around her belly button. Her belly button scar is imperceptible. We can't even tell she's had a tummy tuck. Her waist is curvy. Her tummy is flat. And she was so happy that she proceeded to go back to the gym, take care of herself, and lost even more weight after her tummy tuck than she thought she could after she just had the bariatric procedure. So a lot of times patients ask me, can other procedures be performed along with the tummy tuck? And the answer is yes. Commonly we do a lot of different things. If it's safe, safety is always first. You can have a breast augmentation or a breast lift performed at the same time with a tummy tuck. That's sometimes what we call a mommy makeover. You can have liposuction or liposculpture with fat grafting if it's safe and not an encumbrance to recovery from the tummy tuck procedure. Brazilian butt augmentation or Brazilian buttock lifts are a common procedure I almost always perform with the tummy tuck. And in the patient who feels like there is sagging or flattening in their buttocks and they're having a tummy tuck, I commonly perform a limited liposuction in the lower flanks and I graft the fat to the buttock area. And it's one of the best results that patients in that situation could expect is that they get the curves back in their waist, their abdomen gets flat, and their buttocks get full and more youthful. Again, not everybody needs that procedure, but it's a very welcome procedure for patients who need it. And last but not least, some patients don't need a full tummy tuck. They might need a mini tummy tuck like the last case we saw, and an umbilicoplasty, which is a common problem with patients having loose skin above the belly button, but not enough to have a full tummy tuck. And sometimes patients present with hernias, which are very easy for board-certified plastic surgeons to fix. At the same time as a tummy tuck, because we have an excellent view at the time of a tummy tuck to fix any hernias they might have. And of course, these need to be discussed in consultation with your plastic surgeon prior to surgery to address the hernia at the time of the tummy tuck repair. In the next patient, we see a patient who really didn't have a lot of skin looseness. She had a lot of liposuction, and she had a very minimal amount of tightening, but she also had liposuction of the abdomen and flanks. And several weeks after, we can see how she's lost the fat around her abdomen and flanks. She's early post-surgical, but we took a lot of fat and we grafted her buttocks. So this is what she wanted. She wanted to have a gluteal augmentation, or what we call the Brazilian buttock augmentation, where we grafted the fat from her liposuction to her buttocks. And we can see her view in the preoperative time. She has a lot of fat in her waist and her upper flanks, and the buttocks are relatively flat, and subsequently she's transformed in the next slide to curvy in the waist and full buttocks. And again, this is very early on. We can still see the redness in her liposuction scars, but she was very happy achieving that tightness that she wanted in her abdomen, at the same time sculpting her body, which were her goals at that time. The next patient is a common example of a patient who comes to my office, a mom who has had children. She feels that her breasts are too saggy, or her abdomen is loose. She just cannot make the move to get herself to lose weight or go back to the gym. We performed a breast augmentation, breast lift for her, or augmentation mastopexy, and an abdominoplasty or a tummy tuck, all at the same time, a mommy makeover. And here we can see that, how she looks several weeks later, except with a tan. She got her beach body back, and she has a breast lift, a breast augmentation, fuller breast, and a flat tummy. Her belly button scar is invisible. Her scar from the tummy tuck is healing but imperceptible and well hidden with her bikini. This patient presented with very large and heavy breasts. She had shoulder pain, back pain. She felt overweight. She had an abdominal laxity. She needed a tummy tuck and a breast reduction. And subsequent to a breast reduction and tummy tuck, she continued to lose weight and get the body that she wanted. And we can see in the next slide, this is her a few months later after having had a breast reduction and a tummy tuck. Next, this is just a diagram I made. Increased self-image is what gradually leads to transformation. And improving the self-image, even though we like to undermine that and say that it's probably not that important, is really important. And in every individual, it has a variable degree of importance. And by putting a few different variables together in a well-chosen patient, we can have a safe outcome that is truly life-transforming and makes the patients really happy and capable to move forward and grow in their transformative life. The personal goals, again, I just referred to this, the self-image. One thing that I'd like to also underline is the decreased appetite. With a tummy tuck, oftentimes we see that the patients have lowered appetite, and that's partly because the muscles are tightened and there's less room for expansion of the abdomen. So patients commonly tell me that they just can't eat as much as they could before, and that, along with the improved self-image, really helps in continued weight loss and improved lifestyle after surgery. Postural improvements are also very significant. When you remove that excess skin that's hanging in some patients, you get a postural improvement, physical activity is much easier, and all of these things come together to give us amazing results. Finally, in the next slide, I put this photograph in because I want to stress the importance of exercise. It is wrong to feel that you can have a tummy tuck so that you can avoid exercise. Exercise, healthy lifestyle, healthy diets are very important, and I always recommend them to patients. Some patients, I even recommend them before I allow them to have a tummy tuck, to get them started before the change that will come with the tummy tuck. And it's very important to remember that no matter what the tummy tuck accomplishes for you, really the key to that ultimate change is in your hands, to get the best possible results and really get that inner change that a physical change can bring for you. I hope that this video has been helpful in explaining what a tummy tuck is, what it can do for the patient who's a candidate for an abdominoplasty.